Hey everyone, today's lesson will focus on atrial flutter. So if you are in nursing school, I am the Nurse Doc Tutor, and this channel is dedicated to helping you, yes you, pass nursing school. So don't be stingy, share this with your classmates so you all can pass your exam. So today's lesson will be on atrial flutter, so let's get started. So first I want to go over a EKG wave to let you know how it's supposed to look and what it actually means. So our P wave shows atrial depolarization. So that means that the atrium contracts, and when the atrial contracts, it then pushes the blood to the ventricles. All right, so then we have our QR complex, and that shows ventricle depolarization. So that's when the ventricles are contracting, and once the ventricles contract, it pushes blood to your lungs and your body. Then you have your ST segment, and this is a pause between contraction and recovery. The heart muscle is starting to recover right here. And then your T wave shows ventricular repolarization, and this is where the ventricles are resetting and getting ready for the next beat. So before we go into abnormalities, we need to know what it should look like and what is the role of each thing, whether it be the P wave, the QRS, or the T wave, or the ST segment. So first, we want to look at the name, atrial flutter. So this lets us know that this is going to be an issue with the atria. So our atria is our what? Our P waves, and our atria represents atrial contraction. So let's get that out the way before we begin. So what is atrial flutter? Atrial flutter is an arrhythmia where the atria beats very fast, but in a more organized way than atrial fibrillation. So with atrial fibrillation, we have quivering, but with atrial flutter, we have a flutter. So your rate for this one is much less than atrial fibrillation. So with atrial flutter, your atrial rate could be 250 to 350 beats per minute. So how to recognize atrial flutter on your EKG strip? So with atrial flutter, we know that it is a problem with the atrium, so we're going to have problems with our P waves, right? So if we look at the strip, we don't see any P waves here, but what we do see is we see F waves. So these are going to be called our F waves. So one way that you can easily recognize it is thinking about it as a sawtooth. So they look like little sawtooths. These are not P waves, you guys. These are F waves. These are those sawtooth flutter waves, okay? So with atrial flutter, you still will not see P waves on your EKG strip, okay? So the next, you can see regular or irregular rhythm. So it could be regular or it could be irregular. It really doesn't matter. But the biggest thing for you to know is that it does not have distinctive P waves. Now, you also can see that your QRSs, those can be regular. So as you can see, like this one has a regular one right here in its spacing, and this one right here is regular as well. So you want to make sure that with your atrial dysrhythmias and arrhythmias of things like that, we just want to remember that our problem is going to be with the atria, and the atria is our P waves. So with atrial flutter, we do not have any P waves. Instead, we have flutter waves. So what are some causes of atrial flutter? It's going to be the same as with atrial fibrillation. So if a patient has pulmonary issues, which can cause strain on the heart, and it could trigger AFib. If your patient have any type of ischemia, which can irritate the heart. If your patient has rheumatic heart disease that causes like damaged valves, that can disrupt heart rhythms. Alcohol as well can cause, heavy alcohol use can cause temporary heart dysrhythmias. Also, hyperthyroidism is another thing that could trigger arrhythmias, and your electrolyte imbalances. Any type of stress or trauma or inflammation can trigger heart arrhythmias. So, what are your nursing actions if a patient has atrial flutter? So, if the patient is stable, meaning that the patient is alert, the patient is oriented, the patient vital signs are, is rather normal, hasn't really changed from their baseline, then we're just going to put the patient on telemetry and we're going to notify the physician, and then we're going to prepare to give rate controlling medications, okay? So medications such as our beta blockers or our calcium channel blockers to slow down that heart rate. Also, you can get your EKG and labs, electrolytes, troponins, TSH, things like that. And you want to educate your patient on symptoms and medications and follow up, okay? Now, next, let's talk about if your patient is unstable, meaning that your patient has low blood pressure, chest pain, altered level of consciousness. We then want to call the provider / a rapid response. We want to administer oxygen, monitor their vital signs, make sure that the patient has IV access, and then we want to prepare that patient for synchronized cardioversion. So they may sedate this patient with the cardioversion, and then we want to monitor the patient's post-cardioversion rhythm. So let's talk about electrical synchronized cardioversion. So if a patient is in an irregular heart rhythm, what we can do is we can place these pads on the patient, and we basically can give the patient a shock, which would then put them back in normal rhythm. So you will see this also with atrial fibrillation, but this can also be done in unstable flutter. So if a patient is experiencing signs and symptoms of low blood pressure, chest pain, decreased level of consciousness, or altered level of consciousness, then this is the route that we would go. So you have learned a lot. So now let's see what you learned. Let's do some NCLEX questions. A patient with a history of atrial flutter presents with palpitation and dizziness. Telemetry shows atrial flutter with a 2-to-1 conduction and a ventricular rate of 150 beats per minute. The blood pressure is 82/60, respirations 22, O2 is 95%. What is the nurse's priority action? Is it A, administer IV ditalzam to slow down the ventricular heart rate? B, prepare for immediate synchronized cardioversion. C, recheck the blood pressure in 15 minutes. Or D, instruct the client to perform the Valsalva maneuver. So I'm going to give you some time to think about it. If you chose B, prepare for immediate synchronized cardioversion, then you are correct. So this patient is experiencing unstable atrial fibrillation. Because of that blood pressure of 82/60, we would need to get this patient cardiovert. So when we cardiovert them, that will restore it will hopefully restore the patient to a normal rhythm. The nurse is caring for 4 patients. Which patient should the nurse see first? Is it A, a patient with atrial fibrillation who reports fatigue? B, a patient with atrial flutter with a heart rate of 120 beats per minute who is waiting a cardiology consult? C, a patient who is on warfarin with the INR of 4.2 who reports bleeding gums? Or D, a patient who has newly started on metoprolol who has a heart rate of 78? So I'm going to give you some time to think about it. But if you chose C, that patient with that INR of 4.2 and who reports active bleeding, we want to go see that patient. So that patient's INR is definitely elevated. So we would want to go see that patient because they are at risk for bleeding and they are currently bleeding. So we would go see that patient first. A patient is newly diagnosed with an atrial arrhythmia. The provider explains that the rhythm has a regular ventricular response but originates from a single reentry current in the atria. The nurse knows that this rhythm is most consistent with which condition? Is it A, atrial fibrillation, B, atrial flutter, C, supraventricular tachycardia, or D, sinus tachycardia? So I'm going to give you some time to think about it. But if you chose B, atrial flutter, then you are correct. So what lets us know that this is atrial flutter is it says that the patient has regular ventricular response, okay? I hope you guys got this one correct. And just like that, the lesson is over with. So I hope that you have learned a lot from this video. So share it with your classmates, and I will see you guys in the next lesson. Thanks for watching.